Today we're going to go over this idea of upper back expansion. What we see sometimes is people will lose the ability to move their limbs overhead or internally rotate or externally rotate, mainly because we can't get this thorax to expand forward to back or side to side when we're breathing. So what will happen is we'll get compression somewhere up in this glenohumeral joint area, and it'll cause the joint to not move as well as we'd like it to. The big part that we have to understand is that we have kind of like three segments that we have to be aware of. We have this kind of lower cervical, upper back position. We have this mid-thorax or kyphotic spot in the rib cage, and then we have this lower lumbar area. What we'll typically see, even in someone that looks like this kind of posture, is this upper cervical space really compressed. All right? And what happens is we try to keep pulling people back into this retracted position, but not really getting the result we want, mainly because this is still compressed and this is still compressed, which means the only place for air to go when we are trying to breathe or move is still in this mid-back position, which will then just dump us back into this position as well. So how do we get around this? What we want to try to do is drive air up into this space. So we have a couple of options. The one that we're going to go over today is this kind of hands crossed between the knees flex position. So what you're going to do is you're going to get the outside pinkies touching. We're going to bend forward, push this between our knees. We're going to let our head drop a little bit, pushing our upper back to the ceiling. We're going to take a breath in through our nose and then exhale. When we breathe in, we should feel that whole upper back and mid-back expand. All right. What we want to feel is, especially almost up in this space, get some stretching and some pressure. So don't think about just driving the mid-back up to the ceiling. Think about trying to get everything to expand. All right. Give this one a try. Let us know how it goes.